Hey guys, welcome to another episode of the Four Pillars of Health with Kevin Davis here. Today we're going to talk about stress. We're going to talk about what causes stress. What exactly are types of stress to your body. It's going to be more than what you think. We're going to talk about what it does to your body, and of course, then we're going to talk about what you can do to alleviate stress. Now, if you are like most people that I come in contact with, there's stress in your life. If I was to come up to you and say, you cannot, I want you to get healthy. I want you to take away all the stress in your life. That's not going to work. I understand that because we all have stress. But what we want to do is learn how to compensate for the stress, how we can reduce stress, and how we can focus on other areas in our life so that when we do have stress, it doesn't cause all the detrimental effects to our body that it would be if we weren't doing the other things to be healthy. So it's about encompassing the whole self. It's about encompassing your whole life so that you can combat the stress that you're going to get from life just because that's the way it is. Now, if you don't know me, my name is Kevin Davis. I'm a physician assistant and online health coach. And what I do is I help people, especially over 40, lose weight, gain muscle, and optimize their health. Our goal is to get to the root cause of your issues so that you can live the life that you want to live and not only get the results now, but also keep them. So stay tuned and let's talk about stress. Now, stress, we're going to talk about 6 areas where you get stress, okay? Most of the time when we think about stress, we think about, the pressures of work, family life, financial, those type of things. So we're going to talk about that. But the first thing I'm going to talk about is food. Now, you may be thinking, well, how does stress cause my issues with my food? Well, things like increasing your caffeine can cause stress to your body. If you are eating a high sugar, a high processed food diet, that's going to cause stress to your body. Now, you don't feel it like the stress you would be like from a financial situation, but your body perceives that as the same as if it was. So when we have stress, it's how your body perceives it. It's kind of like a big bucket, okay? Whatever goes into the bucket, whatever comes out the end is the same, right? So if you put stress from financial, stress from food, stress from emotional, whatever it may be, your body perceives it all as the same. So it doesn't matter where it comes from, it's your body's response to the stress. And food, because we have to eat every day, food is something that causes stress. If you're eating a high sugar, high processed food diet, your body's getting stressed. And we can do labs on that. We can check your CRP, your SED rate. And when we check these things in your blood work, if they're elevated, then we know your body has some stress, and it could be from your food. So you need to really concentrate on what are the kind of foods that you're eating and alleviate that. So if you're in a situation, you're financially troubled, say there's problems with your marriage, with your kids, no matter what it may be. What's the first thing we want to do is usually eat some sugar, eat some processed foods. But if you can get it in your head to where you think about, okay, if I do these type of things, it's going to make my stress worse. So if you can go through these periods of time so that when you're having those stress, emotional stress, and you're having the right kinds of food, you're going to be able to handle this much better. On the other side of that too, is if you have a lack of calories, in starvation mode, that can stress your body out. So we have to have a balance with that. A lot of people ask me, should I fast? Should I do intermittent fasting? Should I do time-restricted fasting? And my answer always is, it depends. If you are metabolically healthy and you are restricting your calories, that's not a good thing. If you are metabolically not healthy, it could be a positive thing. So it really depends on your situation. And what we want to do in our coaching program is to help people identify when they should when they should fast, when they shouldn't fast. Why are you fasting? If you're just fasting because that's the latest trend, you're probably doing it wrong, especially if you're not getting the results that you want to get. So fasting, caloric restriction can be a reason to stress your body. Second reason your body perceives the stress is emotions. Emotions is so much intertwined with stress. If we have stress in our life, then it's going to affect our bodies. And there's a difference between good and bad stress, and we're going to talk about that in a second. But if you're having a lot of emotional stress, I really urge you, the other things that we're going to talk about at the end of the podcast, as far as treatments, you really need to concentrate on those type of things. Because if you do, it's not going to make that stress affecting your body as bad. Third thing that can stress your body is pain. Physical pain causes stress. If you're somebody who has a chronic injury, you have back pain, knee pain, no matter what it is, arthritis, those type of things, those things can really stress your body out. And again, when it starts to stress cascade of effects, we're going to learn it causes other issues with our bodies. So physical pain is something that can cause it. Inflammation from anywhere. It could be from your food. It could be from toxins. It could be from a lack of sleep. So when your body senses there's stress, there's an inflammatory. And I talked about 2 blood tests just a minute ago, your CRP and your ESR, which is your SED rate. If you get these tests and they're elevated, you're inflamed for some reason. You got to figure that out. One of the most common reasons why we see people having inflammatory factors go up is because of gut issues. You have leaky gut, you have dysbiosis, and a lot of times if you go back one step further, it's the foods that you're eating. So if you're having heartburn, if you're having bloating and those type of things, those are the things that can really cause stress to your body, which causes inflammation. The fifth thing is hunger. If you're going around hungry all the time, that can stress your body out because your body is wanting to survive. And if it senses hunger, the problem that you have is, it sends a stress mechanism to your body to increase cortisol, which increases insulin, because insulin is your fat storage hormone. So you can kind of see it's a survival mechanism. So if you're having hunger, now, if you're trying to lose weight, you may have hunger at some point. That's why you need to know how to go about the process of losing weight. The best way to keep it off and lose weight now and keep it off. So many people want to lose weight. They go on a crash diet. Your body kind of goes in starvation mode, causes stress, causes cortisol. There's all kinds of different hormones that are affected there. But if your hunger is causing you to have symptoms to where you are increasing your stress hormones, then that is going to be detrimental, and it's going to get in the way of you getting results. And the sixth thing, as far as causing stress to your body, is a lack of sleep. Sleep is something for me personally. Sometimes I catch myself trying to steal from this, and what I mean by that is if there's things I need to do, I'll get up earlier or go to bed later, and those are the things that really are backfiring in a long term with your health. So if you're not getting enough hours of sleep, if you're not getting the right type of sleep, if you're not getting deep sleep, those are the things that causes stress to your body. If you have things like sleep apnea is a very common thing, and a lot of people don't even know they have it. A lot of people think it's just if you snore, but you can also have sleep apnea and not snore. So if you're having issues where you're having a lack of sleep, it can cause stress to your body, and there's going to be a cascading of effects. So the way I want you to think about stress is like anything else in your body. You want balance. Let's just take insulin. I mentioned that just a minute ago. It's your fat storage hormone. You want a balance. If you have no insulin, then you're a type 1 diabetic and you have to take insulin. It's so important that if you don't have it, we need to give it to you or you're going to die. On the other hand, having too much insulin leads to fat storage, and that's what most problems that I see is when people have too much insulin, they store too much fat. So you need to have that balance. You need to have it high when it's supposed to be high, like when you eat, and I mean high relative speaking, and it needs to go back down when you're not when you're not eating, and you want that balance. So with stress, there's a balance. So when you have an acute injury, you need to have stress. You need to have your body's getting stressed because it releases things to help heal. So if you have a sprained ankle, you have some inflammation. That's good. Not good that you have a sprained ankle, but the way your body responds to that is good because it sends things to help repair that stress. But if you have chronic stress, then it becomes a state where your body starts working against itself. And that's where you start seeing these effects as far as like not being able to reach the results that you want to get. So if you think about that, there's a balance. And I want you to think about a gas pedal, and I want you to think about a brake pedal. There's if you think about the way your body responds, it's under the umbrella of called your autonomic nervous system. Your autonomic nervous system just happens automatically. Like you don't sit there and, for instance, tell your heart to beat. It's just beating, right? It's automatically done. So with your autonomic nervous system, there's two different levers. There's a sympathetic, which is your gas pedal, and there's a parasympathetic, which is your brake pedal. So when you're driving a car, there's a time to push your gas pedal, and there's a time to hit your brake pedal. You're not going down the road hitting both at the same time, and you're not releasing at the same time. And that's the way your body works. There's a time for you to have an overdrive. And the common thing is like, okay, if a bear is chasing you, you want to be in sympathetic mode, because that's the things that's going to alert you and get you going. So some of the things with the sympathetic nervous system, your heart rate increases. Just like you press the gas pedal, your car goes faster. Your heart rate increases when your sympathetic nervous system is activated. You have dilated pupils. You can see better. You're sweating. Because it's going to cool itself because it's in overdrive, and you have increased alertness, which is good, because if your bear is chasing, you need to know where it's from. If you do the opposite of that, that's your parasympathetic nerve. That's the brake pedal. That's when you should be rest and relaxation. So that slows your heart rate down. It constricts your pupils. Your digestion and energy is in a conservation mode. You have relaxation. So sometimes you need to be in the gas pedal. Sometimes you need to be in the brake. And that's where you need to have that balance. If you're having an issue, when I talked about chronic stress, if you're always in a sympathetic mode, then you can just think about your heart rate. Your heart rate's always going higher than what it should be. Well, what happens when your heart rate goes up too much over a long period of time? It can lead to things like blood pressure, cardiovascular disease. It can affect your kidneys, because the flow of blood down to your kidneys is affected by the arterial pressure within the vessel wall. So you want to be able to get at balance. You need to be just like driving a car, a brake pedal and gas pedal, to know when one should be pressed and when the other one should be pressed and released. So you have stress, right? What happens when you have stress in your body? A couple of different things. There's immediate response, okay? And this has nothing to do with the cortisol. This has to do with some other hormones. But through your hypothalamus, which is in your brain, it releases things like epinephrine and norepinephrine. And what those are is kind of like, you think about it, when you epinephrine is kind of gets you going. So when you have a stress release, you have that epinephrine. A few minutes later, that's when the cortisol is released. And with the epinephrine and norepinephrine, that gets reabsorbed really quickly, so it doesn't stay around very long. But the problem is the cortisol can. And if you have chronic stress, it's being produced way too much at a higher level than what it should be. So let's say that you're somebody who gets stressed, okay? And we've talked about different ways that you can get stress: emotional stress, food, toxins, inflammation in your gut. You're not sleeping well, and things like that. So what happens with your physical health when you have too much stress on board? And we're going to talk about 5 things that can contribute or be a result of having too much stress. One is your cardiovascular system. I already talked about your high blood pressure. It can be related to high blood pressure. It can be related to cardiovascular disease. It's like that gas pedal's being pressed too much, too long, and it's causing stress on your body. 2 is your immune system. If you know people who are stressed all the time, maybe you see that they're sick more often than not, because of the decreased immunity that comes with with increased stress. Third thing is digestive issues. I already talked about some of that. If you have bloating, heartburn, those type of things, sometimes that can cause issues within your gut. There's something called leaky gut. And what that is your one cell lining of the interior of your digestive system can be have holes in it when that's where it allows toxins and things like that should not go through, and that causes a cascading effect of things that's happening in your body that's causing stress because foreign materials getting in that shouldn't get in. So if you're having stress, think about, okay, or if you're having digestive issues, think about, are you having too much stress? A lot of people are associating like ulcers with stress, and that's one of the things that can cause it. Musculoskeletal system. We mentioned pain before. If you're somebody who's stressed all the time, maybe you're having some joint pain, some muscle pains. And it could be because of the inflammatory things that are happening because of the stress. And number 5 is skin health. If someone who has eczema a lot, dry skin, have those little bumps on the back of their upper arms, that can relate to too much stress. Again, it's not maybe emotional stress. Maybe it's from the foods that you're eating. Now, we've talked about some physical health. Let's talk about mental health and the impact of stress. There's going to be 2 different things that we're going to talk about is anxiety and depression. There's been studies that show that if you change your diet, if you go to a low sugar, low processed food diet, it can actually be better than actually medications for anxiety. If you're having high or low blood sugars, if you're having a lot of fluctuations in your blood sugars, and they could be in the normal range, that can cause you to have more stress in your body, and you'll feel that because you get anxious. You ever get that feeling where you get, quote, hangry? And what I mean by hangry is you get a little bit hungry and you get a little bit angry at the same time. So, and you eat something, then you feel better. It's because you're having these fluctuations, and that's stressful to your body when you have that. Again, we want balance in our body, and that's the thing that we need to go for. And the other thing is, second thing on mental health is cognitive function. What I mean by that is think about like your memory, Alzheimer's, those type of things. If you're having trouble with concentration, if you're having trouble with your memory, decision making, those type of things, that could be from underlying stress. Again, it could be emotional stress. You're stressed out from a relationship or financial things, but it also could be from the things that you're doing to yourself, such as, the foods that you're eating, getting lack of sleep, those type of things. So hopefully that gives you some information as far as what's causing the stress, what it's doing to your body. Now, the most important thing is, what can we do about it? So the main thing when you're coping with stress, we're going to talk about 4 different things. And if you've been a listener of mine in the past, it goes back to our 4 pillars of health. I think we always have to go back there. But when we're coping with stress, I'm telling you that, and I understand, I get stressed as well. There's things that's happened in my life just like your life. But the things that we can control is the things that we need to concentrate on. Now, we still need to concentrate on the source of the stress and, address that as well. But if we're going to have stress, and we know we're going to have stress, then if you can build up these other things, then you're going to be able to get way ahead of the game so that when you do have stress, it's not going to affect your body as much. So it's going to be more of a balance. If you got these things out of whack, these things that we're going to talk about, if they're totally off the charts, you're not doing those things, and then stress comes along, a lot of times you just can't handle it as well. So if stress is coming, whether you're having it now or having it later, we know that. Do these things so that you can get to the point where you can deal with this much better. First thing is prayer. As a Christian, I think that the prayer and knowing that God's in control, that nothing happens without Him knowing, is one of the most comforting things that I have. Sometimes when I get stressed, I just have to put it in His hands, and it's a growth in my relationship with Him. So if you have that, that's probably first and foremost, you need to do this first. If you do not have a relationship with Jesus Christ, we need to talk. Maybe we can help guide you or talk to you about, from Scripture, the things that I believe, and it may help you as well. Obviously, we're not going to say for that, but it does help. If you're not a Christian, doing some mindful meditation, where you're doing some deep breathing, those type of things. That helps you put you back in the in the parasympathetic mode, not the sympathetic, and it kind of helps slow down that stress response. Second thing is physical activity. Many studies have showed if you are physically active, if you're somebody who works out on a regular basis, you're building muscle mass, you're doing those type of things, you're going to be able to handle stress so much better than someone who is not doing that. So I really encourage you. This is another reason why we need to incorporate physical activity, especially with the weight training, the resistance training, into your routine. Third thing, obviously, is nutrition. Nutrition is so important. We've talked about the fluctuation in your blood sugars. It can cause fluctuation in your insulin. What you're eating can affect your cortisol. So cortisol is kind of like the basis of a lot of things that we talked about. But if you're not doing these things, if you're not including like a whole food diet, getting rid of the sugar and the processed foods, I'm saying you can't eat those ever. I eat those, but let them be at least 10% less of your caloric intake that you take in. So if you can incorporate just a whole food diet on a regular basis, you're going to be able to handle stress so much better. And the fourth thing, obviously, is sleep. We talked about, I personally sometimes want to rob me from my time that I have things to do, and I take that away from sleep. Can't do that. That's where having somebody with accountability that can help you track your sleep. I wear an Oura Ring, and wearing Oura Ring really does help as far as being able to make me accountable. Now, I don't do 100%. Always from what the Oura Ring says. I go by how I feel as well, but that can help me keep accountable to myself as far as the things that I need to be doing. So hopefully this has helped. Hopefully we understand that stress is going to come. The different things that causes us to have stress, what it does to our body, and most importantly, the four things that we can do to combat stress. So if you're needing some help with this, if you find yourself stressed out all the time and you're just not getting the results that you want to get, this is where our online coaching program can come in. We can help identify some of the things that may be causing your stress, may be causing you to get lack of results, and we can concentrate on those. Everybody's a little bit different. Sometimes people come in and it's a sleep issue. Sometimes it's a prayer issue. It's a spiritual issue with them. Sometimes they just don't know what to exercise, or sometimes they don't even know what to eat. They get confused with so many things out there. So if you're interested in that, we would love to have a conversation with you to be able to help guide you. We have many different levels that we can help you on depending on what your need is. So the best thing to do is just schedule a call, and then I can talk to you. Again, it's not a sales pitch or anything like that. It's just something that I know that I can help you with if we have that conversation and I know a little bit more about what you need specifically. Anyway, hopefully this has helped today with your stress. Now let's turn our attention to the catechisms. We're on the fourth commandment today. So the fourth commandment is this: remember the Sabbath to keep it holy. 6 days you shall labor and do all your work, but the seventh day is the Sabbath of the Lord your God. In it you shall do no work, you nor your son, your daughter, nor your manservant, nor your maidservant, nor your cattle, nor your stranger who is within your gates. For 6 days in the Lord made heaven and earth, the sea and all that is in them, and rested the seventh day. Therefore the Lord blessed the Sabbath day and hallowed it. So we need to keep the Sabbath day holy. And I know that we're busy. And again, I think this is awesome that this happens to be when we're talking about stress, because, we get busy doing things. We have so many things we want to accomplish. And I'm right there with you, okay? But the Lord, we need to follow his example. And his example is he rested on the seventh day. So if he created the world and he knows what's best for the world, then, we just need to obey him and do what he tells us to do by resting on the Sabbath. He knows what our body needs. We talked about the sympathetic and parasympathetic. There's a difference there. There's a balance. So the Lord knows that we need to get those days where we are just rest and relaxation. Not necessarily we just sit on the couch all day, which is okay, I think. But, where we're not doing those things where we're always on the go. Put it in God's timing. I'm speaking a lot to myself right now. Put it on God's timing, and he will take care of you. Anyway, hopefully this has helped. I look forward to see you guys next week on our journey through metabolic health. And remember, be fit and be faithful.
This podcast is for informational purposes only. No patient-provider relationship is implied or established. This podcast in no way represents the practice of medicine. The information given is to be used at the listener's own risk. Please consult your provider before making any changes, as the contents of this podcast is no substitution for your provider's instruction.